Hands. Hands give away age. Along with the face, they are the other part of the body that is uncovered and therefore visible to others. Their surface is highly exposed to aging. Therapeutically, giving back lost volume to the hands is still a little explored area. For the aging of the hand, the most common request is restoring the loss of dorsal volume. To fix this, Radiesse as a biodegradable injection is the benchmark for this indication. The hand has 3 layers, separated by 3 sets of fascia: the thickness of the superficial fatty layer, which varies with age, the intermediate layer, containing the arteries and sensory nerves. The main nerves of the hand are the median nerve, the radial nerve, and the cubital nerve. 2 main arteries of the hand are the radial artery on the outside and the cubital artery on the inside. The deep dorsal layer of the hand, which includes the extensor tendons as well as the muscles of the fingers and wrist. The tendons, which circulate in the hand, are the endings of the extrinsic and intrinsic muscles of the hand. The flexor tendons, for the most part, pass through a canal on the anterior of the wrist. It is recommended that Radiesse be placed in the intermediate layer to avoid damaging the tendons and prevent the product from migrating. The needle technique is a bolus technique. It is done using the 28-gauge needle provided with Radiesse. Identify through the skin the vascular structures and tendons in the hand of the patient and determine the 4 points for injecting these boluses. Position them in each of the intermetacarpal spaces at approximately 1 centimetre below the joints. After complete and careful disinfection of the hand, define the points of entry. Lift up the skin using the thumb and index finger and then inject boluses of 0.2 to 0.5 cubic centimetres of Radiesse under the fascia. Thoroughly shape the Radiesse so that the product is spread throughout the back of the hand using a hydrating cream. Diluting Radiesse may facilitate its injection and distribution. Cannula may limit the post-op complications of needles. Moreover, larger surfaces for injections and long tracks are done from a single entry point. Cannula injections are less traumatic, accurate, and relatively easy. Make the point of entry at the carpal bone. This single point is generally enough. It is best to use a long 25-gauge cannula to cover the entire surface of the hand. If necessary, plan to have a second point of entry. Then, make 3 or 4 retrotracks. The volume injected by retrotrack is approximately 0.2 to 0.4 cubic centimetres, and the average total volume of Radiesse is about 1.5 cubic centimetres for both hands. Some practitioners prefer to dilute Radiesse to facilitate the injection and the spreading out of the product. Radiesse has an immediate effect. Its opacity conceals the veins and fills in the intermetacarpal spaces. Radiesse treatment in the hands is not recommended for patients who have had their axillary lymph glands removed. The patient should not carry heavy objects after the intervention. Edema may appear 2 to 3 weeks after the injection, but this is temporary. A second treatment can be carried out 2 to 3 months after the first one. The results obtained using the Radiesse injection are as follows when correcting hands.